News that the first case of the H1N1 virus has been detected in Kenya has caused a flurry of activity in public health circles, with government officials issuing a countrywide alert. Health officials now say they are not ruling out the possibility that there could be more cases undetected.
It is possible that we may be having more, and it is possible. And we have predicted that it is not a question of when if Kenya would get H1N1. It's a question of when.
The latest case comes barely 2 days after another person also arriving from the United Kingdom tested negative for the virus. Public health officials are, however, quick to add that the country has long since been in a state of preparedness.
We really are not starting from scratch. We are starting from a level where the country was already prepared to deal with a different type of flu, but now we have a slightly different type of flu.
A surveillance system at an airport is a surveillance system. It is never 100% sure.
According to government officials, isolation rooms have been set up in public and private hospitals, as well as screening facilities at the country's airports. But despite these assurances, the question remains, is the country prepared to handle an epidemic?
We are extremely well prepared because we have the diagnostic facilities. There's nothing to panic about.
Swine flu is a respiratory disease first detected in Mexico in April of 2009. This month, UN officials formally declared the outbreak a pandemic. According to health officials, the virus is spread from person to person in much the same way that regular seasonal influenza viruses are spread. Early symptoms include fever, coughing, sore throat, runny or stuffy nose, body aches, headache, chills and fatigue. A significant number of people who have been infected with this virus have also reported diarrhea and vomiting.
Most of the cases are mild, not requiring drugs.
Health officials are now advising the public to avoid shaking of hands and spending long periods in crowded places to minimize the risk of infection. But even as public health officials advise on these basic precautionary measures, questions are being raised on the government's role in playing the all-important part of awareness creation and screening. Beatrice Marshall, KTN Prime.